Come in.
Hi, my name is Selena, and I will be your nurse practitioner provider for the day. I just wanted to come in and introduce myself, and I'm going to close our curtain so nobody can see you and provide privacy. I had to gather all my equipment, and I got everything together. I'm going to go wash my hands, and I'll be right back.
Okay.
Okay, so I'm back. I've washed my hands. I'm going to start off with doing some vital signs. I'm going to do your temperature, your heart rate, respirations. I'm going to measure your height and weight, things like that. Also, I'm going to find out, I'm going to check your orientation. Who are you?
Dakota.
What day is it?
Monday.
Who's the president?
Joe Biden.
Where are you?
My doctor's office.
And what state are you in?
Georgia.
Thank you. You're alert and oriented. I've noted that your skin is pink and moist. You look well developed, well nourished. When you walked in, I watched your gait. You've got normal gait and posture, and you appear to have normal mood and affect. So I'm going to start first with your temperature. So if you could look straight for me. Perfect, 98.6. I'm going to just give you a listen. Just breathe normally for me, please. Perfect. Your respirations are 15 and your heart rate is 84. Okay, so next I'm going to check for blood pressure. Let's do this one. I'm going to have you turn on like that and just relax it for me. Perfect. 110/64. I'm going to have you gently hop down and come over on the skin on the scale for me. Okay, up on the scale. Fabulous, thank you. I'm going to have you come over here and put your back to the wall and put your feet all the way up against the back so I can get your height. Step forward. Perfect, thank you. Come over and back and have a seat for me. Okay, so next for my assessment, I am going to do your head and your face. And first, I'm gonna do an inspection. So I'm gonna look around, and I'm looking at your hair. I'm looking at the quantity, the distribution, the texture. You've got very thick hair, good texture, no patterns of hair loss. Everything looks okay. Just under visual inspection. Pick that up. Thank you. I didn't notice any scaliness or lesions on your scalp. Everything looks normal. I don't notice any nits or anything in your hair or on your scalp. I'm going to look at your skull and I'm going to look for the size, contour, any asymmetry. Stay with the barb. Everything looks symmetric. No involuntary movements noted, very symmetric. The skin is appropriate colored, no discoloration, no lesions, no distinctive facial hair. So now I'm going to have you do something for me to test your cranial nerve 7 and 12. So first thing I'm going to have you do is clench your teeth. Good. And then I'm going to have you clench your eyes, but kind of like squeeze them tight. Good. And then I'm gonna have you wrinkle your forehead. Good. Smile. Stick your tongue out. Move your tongue side to side. Good. Puff out your cheeks. Puffy. Good. I'm going to evaluate the sensitivity of your forehead, your cheeks, and your chin. I'm going to do light touch. So, forehead, cheeks, any pain, anything like that, chin. Nope. Okay. So next I'm going to palpate your temporal pulses for amplitude. So, my fingers over here, right here. It's kind of right in between your tragus and your cheekbone. Okay. Looks good. Next, I'm going to palpate your skull for deformities, depressions, lumps, or tenderness, and I'm going to do the whole head. Anything feel tender? No. No lumps. Nothing out of the ordinary. Everything feels very symmetric. Okay, I'm going to push on your sinuses, and you tell me if they hurt. Kind of push back a little bit when I push. Any pain? Pain. So next I'm going to test your eyes. I'm going to do a couple different tests. I'm going to do a visual fields by confrontation, which I am going to have you look straight at me. Keep looking straight. Thank you. And I'm going to have you look up and right, and then straight right, down, good, up here, your left, middle left, down, okay. Next I'm going to have you cover one eye, okay, and I'm going to hold some fingers out over here. I need you to tell me how many fingers I'm holding.
2? Was that not right?
3. Switch.
You might do it. Okay.
Switch. Here. How many fingers?
2.
Okay, put that down. Thank you. So next I'm going to check your pupil size and your response to light. So just look straight at my nose. Keep looking straight at my nose. Perfect. I'm going to inspect the external structure of your face, your conjunctiva, your sclera, corneas, irises. So I'm just keep looking at my nose. Just going to assess everything. Keep your eyes open. Thank you. In here, I have an ophthalmoscope and I'm looking at your retinas. disc, retina, fovea, and macula. Inspecting them all. Okay, next I'm gonna have you gently step down and stand past this line right here and face the chart for me. Read me the top line.
E
Second line.
F P
Third.
T O Z
Fourth.
P D L E
One more.
D E F Z C.
Fabulous, thank you. Let's come back and sit up here. Okay, so next what we're gonna do is I'm going to assess your lower extremities. So I'm gonna have you lay down with your head that way and your feet this way. I'm gonna slide some of your pant legs up because I need to assess your legs as best as I can. All right, so I'm assessing for hair distribution. Everything's even. Any varicose veins? I don't note any varicose veins. The color is appropriate. No lesions or any texture issues. Look at your feet. Assessing for any swelling, any type of arterial insufficiency. Also going to look at some pulses while I'm down here. Temperature, feet are slightly cold but still appropriate. No edema noted. Assess for skin turgor. Turgor's good. And I'm going to check other pulses. Okay, here. Okay, so I'm assessing the femoral pulses. Okay, now I'm going to have you lift your left leg up and slowly put it down. I'm checking for flexion, extension, adduction, abduction, and internal and external rotation. Okay, then I'm going to have you, bring your left leg out. Good, bring it back to the center. Okay, I am going to have you lift your leg up. Nope, still the same one. And kind of circular. And then bring it, go up, out, and then bring it back to where you started. Thank you. Now we're going to do the same thing with the other leg. I'm going to have you just go up and back down. And then I'm going to have you go out. Thank you. Back in. And then I'm going to have you go up and then rotate it and back down to where it was. Thank you. I'm going to have you bring your knees up one at a time. Okay. Nope, don't put your foot down. Sure, there you go. Any pain, anything like that? Nope. Okay, same thing. Good. Okay, now I'm going to have you bring your knees up and put your feet down. Thank you. And then roll your legs out. Any pain? Okay, back in. Legs straight. Point your toes. Flex your toes. Bring your nose up. Okay. I'm going to put my hand here. I want you to pull your toes up and like kind of pull against me. Good. Same thing with this one. Good. Now push down. Good. Push down again. Fabulous. Thank you. So now I'm going to have you turn and sit on the side of the bed. Let your feet dangle. I'm gonna put my hands in front of your legs. I'm gonna have you push at me. I'm trying to check the strength. Good. Now pull back. Good. Stand up for me. Okay, can you stand on one foot? Thank you. Stand on the other. Thank you. Okay, so next part of my assessment, I'm going to do upper extremities. I'm going to check for skin color, anything out of the ordinary, any textures, lesion symmetry. I'm going to examine your hands. I'm also going to be checking pulses, and I'm going to be doing two tests that sometimes are used to check if you have carpal tunnel. So, first thing I'm going to do is assess both of your arms. Symmetrical. Color is good. No lesions. No unusual textures. Skin turgor's good. Let me see your finger. I'm going to test for capillary refill on both hands. Perfect. I'm also going to check on your toes as well. Good. The cap refill is good on all four extremities. I'm going to check two different pulses. I'm going to check your radial and your brachial. Good. Good. I'm going to assess both hands for anything out of the ordinary, any clubbing. Good, thank you. Okay, so now I'm going to test some strength and some range of motion. So we're going to start with your left, and I'm going to have you put it straight up. Okay, down. Other one. Good, down. And then left one straight up. And down. Straight up. The other one. Thank you. And down. I'm going to have you circular both of them. Good. Okay, shoulders are good. So now we're going to work on your elbow. So I'm going to have you straighten your elbow, bend your elbow, kind of do a circular motion, just checking your range of motion in your elbow. Good. Next up. Same thing. Good. Okay. So now put your hands both out. Doesn't matter which way. I want you to bend your hands up and down, and then a circular motion. Good. Wrist and hands are good. Shoulders, elbows, good. Okay, so now I'm going to do something called a Phelan sign, and I want you to put both hands down, palms together, touching, and wrists together. Any pain, anything like that? Okay. So now I'm going to have you flip them over and rest your arm. So I'm going to do something, and I'm going to tap the pointer finger till almost to your elbow, and it's testing, and you let me know if your thumb or any of your fingers or hands start to get tingly. Okay, stand up for me. Okay, so now I'm going to put my hands on top of your shoulders. I'm going to have you shrug against me and give it some. Okay, good. Arms up. Okay, so I'm going to push down. I need you to push up against me. Good. Going to do the opposite. Touching. Now you push down. Okay, so now I need both hands. Okay, squeeze my fingers. Good. Grips are equal. Now I'm going to push down, and you're going to resist. Good. Wait, no, move your hands the same. We're going to do the same thing. Good. Okay, now have a seat back up there. Okay, so next on my list, I'm going to inspect and assess your nose. So first I'm going to start with the outside, and then I'm going to do the patency, and I'm going to look on the inside. So first I'm going to look straight, assess the outside of your nose, making sure there's nothing unusual, no pain. Okay, I'm going to have you cover one nostril. There you go. Breathe in now. Okay, good. Switch. Fabulous. Nostrils are symmetrical. No lesions or anything noted. I have something on a Q-tip that I put, and I'm going to make sure that you have your sense of smell. So cover one of your nostrils. Can you smell? Does it smell like?
Mint.
Okay, switch. Do you have your sense of smell on that side? Yes, good. Thank you. I'm going to use my light, and I'm going to inspect the inside of your nose. I'm going to have you tilt your head back just a little. Thank you. Thank you. Everything looks good in there. So next, I'm going to inspect your mouth and your throat. So I'm going to start with, the inside and just give it a quick little inspection. I'm going to look for tonsils. I'm going to look at your palate. So first thing I'm going to start with, I'm going to have you open. Stick your tongue out. And I'm just looking around in there. Nothing abnormal, soft palate. There are no tonsils present. See, lift your tongue up. Fabulous, thank you. Hard and soft palate look good. Stick your tongue out. Say ah. Ah. Good. Uvula looks good. Soft palate looks good. Mouth and throat look normal. Next, we're going to do ears. I'm going to inspect the outside of your ears, and I'm going to look for anywhere that's tender, anything hurts. I'm going to assess the outside, the inside. I'm going to do some palpitations. I'm really going to look, and then we'll do some other testing I have here. So I'm going to start with your left. So I'm just checking for symmetry. I'm going to move your hair back. Okay. They are symmetrical. Anything tender? Everything is intact and aligned. I'm going to inspect the auditory canal for discharge or lesions. None is noted on that side. Also, none noted on this side. Next, I'm going to palpate your lymph nodes on your head for size and or tenderness. So I'm going to start here. I'm going to work my way around. Okay. None are noted. Everything feels normal. So next, I'm going to look in your ear. I'm going to check around there. Visualize your tympanic membrane and your external auditory canal. I'm going to do it for both sides. Good. So I visualize your tympanic membrane, eardrums intact. Next, we're going to do something called a whisper test. And I'm going to have you cover one ear, and I'm going to go behind you, and I'm going to say either a series of numbers or letters, and I want you to tell me what you heard. And then once we've done one side, I'm going to have you do the other side as well. It's called the whisper test. So cover your left ear for me. And I'm going to whisper. What did you hear?
XYZ.
Good. I'll switch to the other one. Okay. What did you hear?
4, 5, 6.
Perfect. Thank you. So next, we have two other series of tests, and they are called the Renee test and the Weber test. So the Weber test is I'm going to hit this, and it's going to vibrate, and I'm going to put it on the very, very top of your head, and you're going to tell me when you don't hear it any longer. And then for the Renee test, I'm going to do the same thing. I'm going to tap it, but I'm going to put it on the bone right behind your ear. And you're going to tell me when you don't hear it anymore. And I'm going to bring it outside next to your ear. And then you're also going to tell me when you don't hear it anymore. Okay?
I don't hear it anymore.
Okay. So next I'm going to start with your left ear. Let me know when you don't hear it any longer.
I don't hear it.
You heard it here? You don't hear it.
I don't hear it.
Okay. Now I'm going to do the same thing for the other side.
I don't hear it. I don't hear it.
Perfect. So your hearing is completely intact. Okay, so next part of your assessment is going to be musculoskeletal. I'm gonna have you stand up because I'm gonna palpate your spine. We're gonna palpate all the way down. I'm gonna do your cervical, thoracic, and lumbar. Make sure there's no tenderness, no abnormalities. So stand up for me, and I'm gonna have you turn and face the table. Go all the way up against the table. Okay. I'm gonna have you move your hair, and I'm gonna be palpating from top all the way down. I'm gonna just slide your shirt up just because I wanna look at your spine and make sure there's no abnormalities. Okay, so I'm gonna have you turn this way for me to your right. Thank you. And stand right there. And I'm gonna have you bend down and touch your toes so I can observe your spine. There. Okay, good. Spine straight. No abnormalities, no curvature. Stand up. Okay, so now turn around, facing me, back up just a little bit, and I'm gonna have you do some shallow knee bends. So just kind of bend down, just bend your knees. Good, and come back up. Thank you. So also, we're gonna do some range of motion of your spine. So I'm having you put your hands on your, there, and I'm gonna have you bend that way. Any pain? Bend that way. Any pain? And kind of do like a twisting motion. Good. When you bend down to touch your toes, did it hurt? Lean back some. Any pains? No. Okay, good. So now I'm going to have you normally walk across the room. So I'm going to have you walk up to that line, turn around and walk straight back. And then turn around and walk straight back. Normal gait. Okay, so now stay there and I'm going to have you walk on your toes. There and back. Fantastic. Thank you. Now I'm going to have you walk on your heels. Also there and back. Okay, turn around. Go back. Okay, thank you. Okay, I'm going to have you take 2 steps towards me. And I'm going to have you put your arms straight out. Okay. Now, what you're gonna do is you're gonna bend your elbow. You're gonna keep your arm straight out. Close your eyes. You're gonna touch your left finger. Don't close your eyes. Left finger to your nose. Thank you. And back out. Right finger to your nose. Thank you. Now I'm gonna have you do it alternating and go left, right, but keep your arms like straight out. Okay. Perfect. So next, you can open your eyes, put your arms down. Next, I'm going to have you take your heel of the opposite foot. So take like your right heel and run it down the front of your left shin, and then go and do the same thing with the other side. Thank you. Switch. Fantastic. Thank you. Okay, I'm going to have you come up here for me. Okay, so now I'm just going to do like a light touch, and you're going to let me know if there's pain or if you could just feel it, and I'm going to have you close your eyes. Sorry, I'm looking for something. Okay, close your eyes. Here. Did you feel that?
Mm-hmm.
Here. Yes, any pain? Okay. Yeah. Where was it?
On my hand.
Which one?
Right.
Here. And where's that?
Left hand.
Here.
Mm-hmm.
Okay, where was that?
Left foot. Right foot.
Okay. And I'm going to do it with something else. You also let me know if you feel any pain, anything out of the ordinary. You're going to tell me where you feel it.
Right arm. Left hand. Right right foot, left arm, right hand, left foot.
Thank you. You can open your eyes. Okay. Next, I'm going to try some reflexes. So I'm going to let your legs hang for me, and there's going to be a few places. Thank you. Okay, so now I'm going to take your arm, and ankle. Okay, so the next part of your inspection, we're going to kind of just do a little bit more of the neck, looking at your thyroid glands. I'm going to listen to your carotid, make sure that, we have everything that we need. I'm going to look at size, symmetry, consistency, your cervical lymph nodes, a little bit of everything. So, first is I'm going to look at your neck, which I did kind of look earlier, but I'm just going to look a little bit deeper. I'm going to palpate your cervical lymph nodes. No swelling, nothing inconsistent, no tenderness. Okay, so I'm going to have you tilt your head back just a little bit, and I'm going to have you swallow. Good, thank you. I'm just assessing your thyroid gland. Keep your head tilted back a little bit. I'm going to listen to your carotid. Jugular vein distension. You can look straight for me. Noted. There's no tracheal deviation. Everything's all in the center. I'm going to have you touch your chin to your chest. Okay, good. Your left ear to your left shoulder. Right ear to right shoulder. I'm going to have you roll your head, like do a rotation. Good. And then go straight back for me. And down. Thank you. So next I'm going to do your abdomen. So I'm going to have you lay down with your feet up this way and your head on the pillow. And once you get settled, I'm going to literally just do an inspection first with just visual. I'm looking for contour symmetry, making sure, your belly button looks normal, which is your umbilicus. And look for lesions, anything texture out of the ordinary, any skin characteristics. So I'm going to slide your shirt up for me, please. Okay, so everything is symmetrical. Skin color is appropriate, temperature is appropriate. Umbilicus looks normal. No pulsations, no texture abnormalities. So next, I'm going to also take, which means listen to all 4 quadrants for your bowel sounds, which would be 1, 2, 3, 4. So you've got 4 quadrants, and I'm going to be listening to them. And just breathe normal. So next, I'm going to listen for vascular sounds, and there's a couple places I'm going to listen for your vascular sounds. There is going to be the aorta, which is above your belly button, and then your renal artery is kind of go to the right of your belly button and just go up a little tiny bit, and then your iliac, which is go to the right of your belly button and a little bit below, and then your femoral is down almost to where like your groin area is. So I'm going to use the small side of my stethoscope, which is the bell, to be able to listen to all of those vascular sounds. Button up, so there we go. And go further down. And femoral. Okay, so next I'm going to do something called percussing. I'm going to put my hand and kind of tap tap, and I'm going to listen for any tympany and dullness, and it's 9 different areas. So if you were to take your belly and put it into 9 different quadrants, I'm going to listen to each individual one and percuss and listen. If you notice anything that hurts, tender, I'm also going to be measuring the span of the liver, which is on your right side. I'm going to assess for splenomegaly, which in your spleen is on your right side. So I'm going to be doing all that kind of around the same time. All right, ready? So I'm just going to listen for that dull echo sound. No pain? Okay, I'm going on the left side. Good. Then next, I am going to palpate, which is like pushing on all 4 abdominal quadrants. I'm going to do light palpitation. Let me know if there's any tenderness, anything hurts, anything like that. I'm also going to be looking for any masses. Anything abnormal, anything that just doesn't feel right. So I'm just going to palpate. I'm also going to do some rebound tenderness just here in a second, just to see. Okay. No pain? No pain? No pain? No. No. Okay. So then I'm going to palpate the liver's edge, the spleen and kidneys for enlargement, tenderness, and then also I'm going to palpate for something called the McBurney sign, and it's done in the kind of lower quadrant, about halfway between your belly button and down here where like your femoral artery is, and that's just to check for an appendicitis. So I'm going to palpate the liver's edge. Alright, and then your spleen. Okay, I'm also going to feel back here. I'm going to feel around for your kidneys. Any pain? I've noticed no enlargements, no tenderness. Alright, Barney's. Anything? No? Okay. Okay, so I've got just a few more things to do with your abdominal assessment. One of them is going to be called costovertebral angle tenderness. So the costovertebral is kind of a triangle in your right lower quadrant. And I'm going to kind of palpate and percuss. You let me know if there's any like tenderness, any pain, anything like that. Okay, so then next I'm going to test for ascites, and it's something called shifting dullness. So what I'm going to have you do is I'm going to have you roll on your side and face that way, and I'm going to palpate from your belly button area back to your left flank. Okay, so roll that way for me. Okay, thank you. Anything tender? Good. Anything? Okay, roll on your back for me. Okay, so last thing I'm gonna check for cholecystitis is with your gallbladder. So what I'm gonna do is I'm gonna have you take a deep breath in and hold it, and then I'm gonna palpate in this general region, which is where your gallbladder is, and see if there's any type of tenderness. Okay, so take a deep breath in. Hold it for me. Any pain, anything like that? Okay, you can let it out. Okay, so next part of your assessment we're going to complete is chest and lungs. We're going to do anterior, posterior, and lateral. So first I'm going to look at the configuration of your thoracic cage, which would be, you know, the 12 vertebrae and the 12 ribs. So I'm mainly going to just kind of inspect. I'm going to have you pull your shirt up like that. Just checking out your rib cage. Okay, I'm going to have you turn that way for me and feet that way. But still sitting up. And I'm going to pull your shirt up so I can, if you could pull this up for me, that would be wonderful. Thank you. Okay, so now I'm assessing for color, lesions, texture, still looking at the configuration of the thoracic cage, looking at her vertebrae. We can look at the symmetry of her shoulders. The way she's sitting is not very symmetrical, but there we go, that's better. So I'm going to have you take a deep breath in and take a deep breath out, and we're looking to see if it's symmetrical expansion, if her lungs get bigger and smaller together. So take a big deep breath. Good, and out. Okay, so I'm just comparing the fronts. Now I'm going to have the back and then the front do the same thing. Good, okay. So next I'm going to put my hands on you numerous places, and every time I touch you with my hands, I'm going to have you say 99, and I'm testing for tactile fremitus.
99, 99, 99, 99, 99.
Good. Okay. So I'm looking at her alignments. There's no lumps, no tenderness. Everything looks good. So now I'm going to percuss all lung fields for resonant using proper locations and sequence. So we're going to start here and we're going to make our way down, and I'm going to percuss, and then I'm going to go back and do the same thing, only I'm going to be listening. Good. So now I'm going to be listening, and I will tell you when to, every time my stethoscope touches you, I want you to take a big deep breath in and let it out. Good. Okay, so now next thing is I'm gonna do kind of a similar thing, and every time my stethoscope touches you, I want you to say E and say E, and then when I pick my stethoscope up, stop, and when I go to another spot, you're gonna go E, like saying E.
Okay.
Okay. Perfect, thank you. Okay, so next, and our last part of our inspection is going to be your heart. So I'm going to look for JVP and carotid pulsations. So what I'm going to have you do is kind of turn your head slightly away, and I'm going to use the tangential lighting and inspect bilaterally. Other way. Okay. So next, I am going to palpate the precordium, which is over the heart, and the lower chest, so it's kind of like right here over the heart and just a bit lower. So I'm gonna have you move this arm for me. And I'm going to palpate. Any pains? Thank you. Okay. So then I'm gonna also take heart sounds, and there's 5 different locations. And I'm going to be listening to the rate, the rhythm for S1, S2, presence of S3 or S4, any type of murmurs, you know, anything like that. And just breathe normal for me. So next, I'm going to use the bell, which is the small part of my stethoscope, and I'm going to listen at the apex and along the left sternal border and at the 4th and 5th intercostal spaces, which is kind of like 4th and 5th ribs. So if you count your top ribs, you know 1, 2, 3, 4, and so on. Sorry. Okay. And then next, I'm going to percuss, which means that, you know, thing at the borders of your heart, and I'm going to locate and palpate the PMI. So sit still for me, please. That's all. Any questions? Thank you.